Let's talk about something a lot of us have experienced. Those strange little spots that just kind of drift across your vision. Sometimes they're just a little annoying, but other times they can be genuinely worrying. They're called eye floaters, and today we're going to break down exactly what they are and, most importantly, when you really need to pay attention to them.
You know the feeling, right? You're just looking at a clear blue sky or maybe a blank computer screen, and all of a sudden you see them. Little squiggly lines or dots, sometimes even what looks like a tiny cobweb just floating by. You try to look right at it, but poof, it darts away. If that sounds familiar, you are definitely not alone. So what is actually going on inside your eye? So what are these things really? To get it, we've got to take a quick look at the science behind what's happening inside the eye itself.
Okay, so your eye is mostly filled with this clear gel. It's called the vitreous humor. When we're young, it's nice and firm, kind of like a solid jelly, and it's attached to the retina. The retina is that super important light-sensitive layer at the very back of your eye. You can think of it like the film in a camera. And this vitreous jelly helps the eye keep its round shape.
Now, this is a completely natural part of getting older. As the years go by, that firm jelly starts to get a bit more watery. The little proteins that are inside it begin to clump together into these tiny strands. Over time, that whole gel-like sac can actually pull away from the retina. And those little clumps, they just drift around in there, and when light enters your eye, they cast tiny shadows. And those shadows? Well, that's what you see as floaters.
Now, while this happens to most people as they age, some things can kind of speed up the process. For instance, if you're very nearsighted and have high-power glasses, or if you've had an eye injury before. Even certain health conditions like diabetes can cause you to notice these floaters a bit earlier in life. So, for most of us, floaters are just harmless little shadows. But this brings us to the single most important question. How in the world do you tell the difference between a simple annoyance and a real warning sign that something serious is going on?
Okay, this is the crucial part. Listen closely. That occasional dot or squiggly line that's been hanging around for a while, that's usually fine. But you absolutely must pay attention to these emergency signs. We're talking about a sudden shower of new floaters, like someone shook a pepper shaker in your eye. We're seeing flashes of light, like little sparks or lightning streaks. And finally, a dark curtain or a shadow that starts to creep in from the side of your vision. These are not normal.
And those flashes are such a big deal because they aren't just a trick of the light. They are a physical event. It literally means that the vitreous gel is pulling and tugging on your delicate retina, and that tugging is where the danger really comes from. So if you experience any of those warning signs, there is a very clear, non-negotiable next step that you have to take.
It's the question anyone would ask, right? You suddenly see sparks or a whole bunch of new dots. What do? What is the immediate, right now action you need to take?
There is zero ambiguity here. You don't wait a couple of days to see if it gets better. You don't just call your family doctor. You need to see an eye doctor, specifically a retina specialist, right away. And that's because all that pulling on the retina could have actually caused a tear. And a tear is the first step toward this, a retinal detachment. This is when that critical film inside your eye gets pulled away from the back wall. This is a true medical emergency. Without prompt surgery, it can lead to permanent vision loss. That urgent exam is all about catching a tear before it turns into a full detachment.
But here's the good news. If a problem like a tear is caught early, there's a very effective and surprisingly simple procedure that can prevent a detachment from ever even happening. So if the specialist finds a weak spot or a small tear during that exam, they can act on it immediately. There's a laser procedure that can be done right then and there in the office to create a protective seal around that damaged spot.
It's often called a laser barricade, which is a perfect description of what it does. The specialist uses a laser to make a series of tiny burns, think of them as little welds, all around the tear. This creates a little wall of scar tissue that fences off the tear, stops it from spreading, and prevents fluid from getting underneath the retina. It's like putting up a retaining wall to stop a landslide.
And you know what's incredible? This entire critical vision-saving procedure usually takes only 5 to 10 minutes. It is a remarkably fast way to prevent a much, much bigger problem. And better yet, it's a comfortable procedure. Your eye is numbed with some drops, and it's all done while you're just sitting in the exam chair at the specialist's office. No hospital, no major surgery. It's a simple, pretty elegant solution to a really dangerous problem. Okay, so the immediate danger has been dealt with. But what happens next? What kind of precautions do you need to take? And what about those annoying floaters? Now,
Whether a tear was found or not, while your eye's in this delicate phase, there are some crucial precautions you have to take. Your doctor will give you specific instructions, of course, but generally this means no heavy lifting, no really strenuous exercise. You want to avoid anything that can increase pressure in the eye or cause that vitreous jelly to move around too much.
This is the #1 question on pretty much every patient's mind once they know their retina is safe and sound. Am I stuck with these distracting spots in my vision forever? And the good news is they do become much less noticeable over a few weeks or months. This happens for two main reasons. First, your brain is just amazing at adapting. It basically learns that the floaters aren't a threat and starts to filter them out of your conscious vision, kind of like how you stop hearing the hum of a refrigerator after a while. And the second reason is just simple physics. Gravity gently pulls those protein clumps down to the bottom of your eye, getting them out of your direct line of sight.
So what's the ultimate takeaway here? It's that your vision is just so incredibly precious. And while the vast majority of eye floaters are just a harmless, if annoying, part of life, they can also be the very first signal of a true emergency. Knowing how to tell the difference isn't just interesting, it is the single best tool you have to protect your sight.